Pharmacology of Antipsychotic Drugs by Dr. Yield Espasoni. Objectives, Definition, Introduction, Schizophrenia. Classification of antipsychotics. Mechanism of action. Pharmacological effects. Clinical uses. Adverse effects. Drug interactions. Antipsychotic drugs, known also as neuroleptic or anti-schizophrenic drugs, are used mainly to treat schizophrenia, mania and depressive psychosis. Introduction. Schizophrenia. Schizophrenia is one of the most important forms of psychiatric illness. The nature of schizophrenia. A chronic psychotic illness which affects people during late adolescence or early adulthood. Schizophrenia has a strong genetic component and is probably due to biochemical abnormality, dysfunction of dopaminergic neurons. There is some evidence for involvement of 5 height pathways. Patients with schizophrenia have problems with seeing things, hearing voices, imagining things, having terrifying thoughts. Positive symptoms: apathy, blunted emotions, anhedonia and reduced ability to react with people, social withdrawal. Negative symptoms: schizophrenia, symptoms. Positive symptoms: hallucinations, delusions, thought disturbances. Negative symptoms: blunted emotions, anhedonia, social withdrawal, loss of motivation, impaired personal hygiene. Dopamine hypothesis. Schizophrenia has a strong genetic component and probably reflects too much dopamine activity in the mesolimbic system, which is the part of brain that controls seeing, hearing, imaging, etc. Dopamine hypothesis. Evidences. Drugs that increase dopamine may produce positive psychotic symptoms. For example, cocaine, amphetamine. All known antipsychotics drugs capable of treating positive psychotic symptoms block the dopamine receptors, D2. Dopaminergic pathways. 4 dopamine pathways. Appears that blocking dopamine receptors in only one of them is useful. Mesolimbic behavior. Blocking dopamine receptors in the other 3 may be harmful. Mesocortical, nigrostriatal, tuberoinfundibular. Dopaminergic pathways. Controls movements. Overactivity produces delusions and hallucinations. Antipsychotic drugs. Atypical drugs are preferred as a first-line treatment because they. Antipsychotics are broadly divided into 2 groups, the typical equals first generation and the atypical equals second generation antipsychotics. Atypical drugs are preferred as a first-line treatment because they 1. Have fewer side effects. 2. Have additional benefits for the base symptoms of schizophrenia. 3. Can treat resistant cases. Mechanism of action. All antipsychotic drugs block D2 receptors in the brain and periphery. Atypical antipsychotics exert part of their action through blocking of 5-HT2A receptors. Antipsychotics take days or weeks to work, suggesting that secondary effects, for example increase in number of D2 receptors in limbic structure, may be more important than direct effect of D2 receptor block. D2 antagonist. Many antipsychotics block other receptors e.g. Many antipsychotics block other receptors, for example acetylcholine, M, noradrenaline, alpha-1, and histamine, H1, receptors. Type of 5-HT1-5. Typical antipsychotic drugs. 1. Phenothiazine derivatives. Chlorpromazine, prochlorprazine, promethazine, fluphenazine. 2. Butyrophenone derivatives. Haloperidol, droperidol. Atypical antipsychotic drugs. Risperidone, ziprasidone, clozapine, olanzapine. Quetiapine. Aripiprazole. Pharmacological actions. 1. Antipsychotic effects. Through blocking D2 receptors in the mesolimbic system, antipsychotic drugs relieve hallucination, improve thoughts. The additional blocking effects of atypical antipsychotics on 5-HT2 receptors can treat the negative symptoms of schizophrenia. 2. Autonomic effects. Anticholinergic effects, dry mouth, constipation and blurred vision. Blocking of alpha-adrenergic receptors, hypotension. 3. Extrapyramidal effects. Blocking of D2 receptors in the nigrostriatal pathway causes unwanted Parkinsonian-like symptoms, rigidity and tremors. Clozapine and risperidone exhibit a low incidence of these symptoms. Block D4. 4. Antiemetic effect. Blocking D2 receptors both centrally in the CTZ and the medulla and peripherally in the stomach. 6. Antipsychotics block H1 receptors causing sedation and confusion. 5. Endocrine effects. Amenorrhea, galactorrhea, false positive pregnancy tests in women and decreased libido and gynecomastia in men, due to blockade of D2 in the pituitary leading to an increase in prolactin release, equals hyperprolactinemia. 6. Antipsychotics block H1 receptors causing sedation and confusion. 7. Antipsychotic depress the hypothalamus affecting thermoregulation, hypothermia. Therapeutic uses. 1. Treatment of schizophrenia. Typical antipsychotics are most effective in treating positive symptoms. Atypical antipsychotics with serotonin blocking activity are effective in many patients resistant to the traditional agents, especially in treating negative symptoms. 2. Treatment of other psychotic disorders e.g. 2. Treatment of other psychotic disorders, for example mania and mood, bipolar disorders, depressive psychosis. 3. Prevention of severe nausea and vomiting, drug-induced nausea. Haloperidol 4-droperidol is used in combination with fentanyl and neuroleptin analgesia. Opioid. 6. To induce hypothermia in certain major operations, chlorpromazine. 5. Due to its antihistaminic effects, permethazine is used in cases of pruritus and as a preoperative sedative. 6. To induce hypothermia in certain major operations, chlorpromazine. 7. Chlorpromazine is used to treat intractable high cough. Adverse effects. Antipsychotics have a wide range of side effects. 1. Sedation, drowsiness, is a common side effect of antipsychotics. This can be dealt with by taking medication at night just before going to bed. 2. Movement disorders. Extrapyramidal side effects are common with the typical antipsychotics, i.e. haloperidol, and include dystonia, akathisia, Parkinsonian-like syndrome treatment, anticholinergic drugs, benztropine, y. Extrapyramidal symptoms, EPS, dopamine versus acetylcholine. Dopamine, inhibitory, and AC, excitatory, have a reciprocal relationship in the nigrostriatal pathway. A delicate balance allows for normal movement. Dopamine blockade by antipsychotic drugs results in relative increase in cholinergic activity causing EPS. When high-potency antipsychotics are chosen, we often prescribe anticholinergic medication like benztropine. Tardive dyskinesia. It is the most important adverse effect of long treatment with typical antipsychotic drugs and is characterized by excessive movement of the lips, tongue and jaw, limbs. Tardive dyskinesia may be irreversible and is postulated to result from increased number of dopamine receptors that are synthesized in response to long-term dopamine receptor blockade, which leads to neuronal supersensitivity to dopamine. Atypical drugs have lower incidence of EPS and tardive dyskinesia as they block 5-HT2A receptors and have less D2 receptor blocking effect. 3. Autonomic effects, orthostatic hypotension, alpha-adrenoceptor blockade. The concomitant use of antihypertensive agents must be noticed. And anticholinergic adverse effects, urinary retention, constipation, PPT of glaucoma. 4. Endocrine and metabolic effects, hyperprolactinemia in the form of galactorrhea, amenorrhea in women, gynecomastia and changes in libido and impotence in men. 5 allergic reactions, agranulocytosis, common with clozapine, cholestatic jaundice, chlorpromazine, and skin eruptions. 6 ocular complications, chlorpromazine may cause retinal pigmentation, corneal and lens opacities. 7 clozapine and chlorpromazine tend to lower an individual's seizure threshold. Neuroleptic malignant syndrome. An idiosyncratic, life-threatening neurological disorder associated with antipsychotic therapy. Idiosyncrasy, an unusual or unexpected, ADR, sensitivity of an individual to a particular food or drug. Idiosyncrasy is usually determined genetically and it may be due to a biological deficiency, for example an inability to metabolize a drug. Neuroleptic malignant syndrome. Clinical manifestations include encephalopathy, hyperpyrexia, delirium, autonomic instability, vitals unstable, rigidity of muscles, elevated creatine phosphokinase, CPK, due to increased muscular activity and rhabdomyolysis, destruction of muscle tissue, pathophysiology. The mechanism is thought to depend on dopamine activity due to dopamine receptor blockade. Genetically reduced function of dopamine receptor. There's an increased calcium release from the sarcoplasmic reticulum of muscle cells which can result in rigidity and cell breakdown. Treatment involves immediate discontinuation of antipsychotic drug. Treat hyperthermia. Hydration, maintain vital functions. Dantrolene sodium, a muscle relaxant that acts by abolishing excitation-contraction coupling in muscle cell. Typical antipsychotics. Chlorpromazine phenothiazine class increase prolactin, gynecomastia. Hypothermia. Anticholinergic effects. Hypersensitivity reactions. Obstructive jaundice. Ocular complications. High EPS, flufenazine. Phenothiazine class but causes more EPS. Does not cause jaundice. Causes less hypotension. Haloperidol butyrophenone class. As chlorpromazine but does not cause jaundice. Significant anticholinergic side effects. Strong EPS tendency. Hypotension. Atypical drugs. Differences between typical and atypical groups. Receptor profile. Serotonin receptors, 5-HT2A, are involved. Incidence of extrapyramidal side effects, less in atypical group. Efficacy, specifically of clozapine, in treatment of resistant group of patients. Efficacy against negative symptoms. Risperidone largely replacing clozapine. No risk of agranulocytosis. Low incidence of EPS and minimal sedation. Weight gain. Risperidone is approved for the treatment of autism and bipolar depression. Aripiprazole recently approved drug. Long-acting, plasma half-life 3 days. Unusual D2 partial agonist profile may account for paucity of side effects. No effect on prolactin secretion. No weight gain. Less incidence of dystonias and tardive dyskinesia. Clozapine dibenzodiazepine class potent antagonist at D4 receptors. Selectively blocks 5-HT2A receptors. Sedation. Extrapyramidal side effects are minimal. Low incidence of tardive dyskinesia. Increased risk for seizures, 2 to 3%. Clozapine. Agranulocytosis in 1%, regular granulocyte counts weekly is required. Agranulocytosis risks increase when co-administered with carbamazepine, anticonvulsant and mood-stabilizing drug used in the treatment of epilepsy and bipolar disorder. Anticholinergic side effects. Weight gain. Effective against negative and positive symptoms and treatment of resistant patients. Advantages and disadvantages of clozapine. Effective in the treatment of negative and positive symptoms of schizophrenia. More effective than classical agents for resistant cases. Clozapine has the risk of inducing agranulocytosis. Clozapine tends to lower an individual's seizure threshold. Advantages, disadvantages. Incidence of extrapyramidal symptoms is lowest. Tardive dyskinesia is extremely rare with clozapine. Atypical drugs cause weight gain. Atypical drugs may exacerbate DM and hyperlipidemia. Are more expensive than typical antipsychotics.